What's going on, guys, and welcome back to the World's Okayest Physical Therapist podcast. I'm your host, Dr. H, and today we're taking a look at pain management versus physical therapy. But first, please don't forget to like, comment, subscribe, share, leave a rating, send it to your grandma. Do whatever you have to do to help get this podcast out and about, because I am learning about the American healthcare system as a healthcare provider, and I'm trying to share all my tips, tricks, and tips about the American healthcare system in order to help us all better navigate it and get to the place where we can get the best care possible to improve ourselves. Now, today is taking a look at pain management versus physical therapy and the difference between the two. But first, before I break that down, we have to talk about what they both have in common and why we're even having this podcast conversation in the first place. And the answer to that is two words: chronic pain. Now, you might be asking yourself, well, I'm chronically in pain. True, but there is a specific technical definition that we need in order to make sure that we're communicating the same language as these healthcare professionals. And the answer to that is what is acute, what is subacute, and what is chronic. Acute pain is anything that is within a month. Subacute is, I believe, 1 month to 3 months. And then chronic is anything over 3 months. Okay, so that's the sort of textbook definition that your healthcare provider is going to use. So if you have chronic pain, which is anything over 3 months, well, now you're entering into the realm of pain management. So pain management might not be something you've heard of before. It might not be something that you're super familiar with. And that's because unless you've been in pain for more than 3 months and you've probably seen your primary care provider several times for this condition, it's not something that really enters into the picture, generally speaking. So let's take a look at defining the difference between the two. So there's no such thing as a pain management or like a doctor of pain management. There are doctors who are in pain management. So there usually are medical doctors, anesthesiologists, neurologists, things like this, okay? So it's actually the pain management clinic that you're going to find the pain management specialists in that are going to have these different titles like MD, anesthesiologist, neurologist, etc. They focus on pharmacological intervention such as injections, nerve blocks, medication. They also involve acupuncture, electrical stimulation, and they also can include psychologists and counselors in case there's some sort of behavioral or psychological component to pain. Now, I'm not going to go into the depths of chronic pain on this podcast. That's going to be a podcast for the future. But chronic pain is its whole own beast in terms of how it impacts your mind, how it impacts your body, and how it impacts the brain. So I'm going to leave that for now as a cliffhanger for a future podcast. But suffice it to say, these are all people, these are all professionals of different disciplines that come together to help treat chronic pain in the pain management clinic. So whenever you ask for, I want to see pain management, understand that it's likely going to be a clinic with a bunch of different people in it. Now, a physical therapy clinic, by contrast, is going to have physical therapists in it. And instead of using pharmacological intervention, they're going to be looking at using biomechanical interventions, using the biopsychosocial model. Now, that's a whole bunch of gibberish. What does it mean? It means I'm going to look at using your muscles, your nerves, and your bones to help you do functional mobility. I'm going to look for any sort of restrictions in terms of your strength or your range of motion, and I'm going to try and find out if it's muscular, joint, neurological, or something else that's going on that's impacting how you are moving. And typically what I'm looking at is your posture, your functional mobility, such as your walking, your lunging, your squats, and then you're looking for any sort of muscle imbalances or possible neurological involvement where your muscles just aren't responding to what your brain's trying to tell it to do. In order to get you better, instead of using injections or pain medication, I'm going to be using exercise, stretching, manual therapy, education, electronic stimulation, dry needling, so on and so forth. All the things that we've talked before in this podcast. And instead of a short-term relief, I'm looking at providing long-term functional improvement with pain reduction. So I'm thinking weeks out as a physical therapist, not days. There might be several times where you get better within days, but my goals are usually weeks and weeks and weeks and weeks out. And the biopsychosocial model I referenced earlier, that if you break it down into its subsequent parts, the biological part, so you're getting your muscles, your bones, your nerves, your brain, your psychological component, which is how you approach the tasks mentally. Are you fear avoidant? Are you scared of falling? Are you scared of doing a motion again because that's how you got injured last time? That's what we call fear avoidance. Or is there some sort of social component where you're having to get back to work as fast as humanly possible before you're really ready to be able to pay rent? Is there societal pressure on you to fulfill this role? Or are you putting pressure on yourself to meet other people's demands, etc.? All that falls under the social component. So that's kind of how both approach it. Now, the differences in how we approach it in a little bit more detail, and it being chronic pain. One is more passive and one is more active in terms of what the patient has to do. Pain clinics are often using injections, medications, acupuncture, things like this, which is the patient shows up and they don't really have to do anything besides take their medication, get an injection, have acupuncture performed, whatever. In PT, it is active. You are the one having to do exercises. You are the one having to do stretches. You have to show up and you have to be able to put in the work for weeks. And you also have to be willing to do lifestyle modification where it's, hey, instead of doing this or that way, we have to modify and do it this way or that way. A lot of times what you can see in this is like how people squat, how people lunge, how people walk, things like that. Now, kind of along those lines, one is more short-term relief, one is more long-term management, right? So short-term relief would be I get an injection, I feel better within the next week. PT is looking at, okay, I can get you to have stronger muscles, which will improve your range of motion and reduce your pain, hopefully in your joint or whatever, your low back, your muscles, for example, within weeks. So if you have a muscle strain, we know we're looking at weeks. If you have a fracture, we know we're looking at weeks. Things like that. PT is like, all right, weeks out. Pain management's trying to solve that much quicker. And PT also, along that line, seems to reduce any recurrence of whatever issue it is. So if you have an ankle sprain, we're thinking weeks out, but I'm also trying to strengthen that ankle to make sure it doesn't come back. And I mean, pain management is definitely trying to make sure pain doesn't come back too, but there's really not much that they can do if you're just having chronic pain and you don't know why, and there's really nothing you can modify in order to make it better. Now hold on while I take a sip of water. Thank you. So, cost and risk is the next thing I want to talk about. And I really want to focus more on the risk because cost is usually not so much the consideration between these two. It's much more the risk. And the risk with that is a lot of patients nowadays really don't want to take any sort of pain medication. The opiate epidemic really left an imprint on a lot of people, and the side effects of using pharmacological drugs really left an impression on people's minds. So a lot of people that I see in my clinic say, I don't want to take pain medication my whole life. I want to get better and stronger and have reduced pain that way, which is good. So that's one thing that factors into why people don't go to pain management, is because they have the stigma of, I don't want to take pills. And you can always talk to a pain management doctor and say, I don't want pills, what else do you recommend? And they could, of course, say acupuncture, electronical stimulation. They have all these other tools to utilize as well, but again, that's something that kind of turns people off because they think it's much more risky of them getting addicted to those sorts of things. PT, by example, you show up there and you know what you're going to get. Your PT is going to push you to the max. You're going to leave there sore, sweaty, and probably a little bit grumpy, right? So people look at PT and say, they're just going to make me work out really hard. And they look over at pain management and say, there's a good chance that I can get some strong drugs that I might get dependent on, and I don't want that. Not necessarily true, but it's part of what drives some people's mindsets. It's actually more common in the example I'm going to give later, which I'll hint to right now. When you have patients that have knee pain, for example, it's been going on for years, it's a lot more common for them to continually get like knee injections over time, more and more knee injections over time to help address their pain, instead of getting some sort of like pain medication prescription. And they kind of just live from knee injection to knee injection. Um, a really good summation here: physical therapy is not going to give you instant relief in 10 minutes, but it can help you avoid surgery in some cases, or avoid having to take long-term pain medication. Because again, we're going after the musculoskeletal system and trying to improve how you move and your strength, which should reduce the amount of force going through your joints and help you reduce pain. Now, this next part is the most important part. How does pain management and physical therapy work together? And the answer is beautifully. Beautifully. Unlike the last few podcast episodes that I've done, where sometimes it's a rivalry and sometimes it's a hierarchy, in this case, it's almost 110% collaboration. Pain management and physical therapy are almost meant for each other, in my experience. When you have the pain management team working with you, you basically fill the niche of, I'm going to help the patient move better. Because the MD, the anesthesiologist, the psychologist, whoever it is that they're seeing, they're going to be helping address how the patient, how much pain the patient is in, trying to reduce it, and also helping address how the patient perceives the pain and engages with pain. Then by the time that patient comes to my clinic as a PT, I already am dealing with someone who has reduced pain, and I'm going to have a lot more buy-in from them to do motion, to do stretching, to do strengthening, to do functional mobility, to do gait training, all of these things. The PT is going to almost always be more effective after the pain is reduced by whatever it is that pain management is doing, whether that be an injection, an ablation, or whatever. So it usually tends to work better in the order of going and seeing pain management first and then seeing PT after, though it doesn't always have to be that way. I've been treating people that went and saw pain management. While I was treating them, they got the interventions that they needed from pain management. They came back and they were much less pain, so way more buy-in to doing things that they thought were crazy before. So the ideal workflow goes, if you're in pain early, let's say an acute issue, so within 4 weeks, you get sent to PT right away. And PT is working with you, trying to help you improve. If you improve, great, we solve the problem. If you don't improve, you get to go back to the doctor and say, hey, PT is not helping me as much as I would like. I think I can go and see pain management. But it also works the other way, where it's, hey, I'm in and out of pain management now for 6 months, 7 months, 8 months. I'm just not getting better. And pain management says, well, let's try PT. So it does work both ways, but typically PT can help you more when it's in the acute phase. And when you're in the chronic phase, it just takes longer, and that's why pain management is really helpful to help get over that bump, that hill, and to get you back on track. But again, the relationship is beautiful because either way you go, if PT is not working in after trying it for 8 to 12 weeks, PT is usually going to say you should go and see pain management because maybe something else is going on here. And if pain management's like, hey, I hear you, you don't want to live injection to injection, maybe you should try PT, it's a beautiful cycle. No matter where you're at, if you have pain long enough, you're probably going to end up at pain management and then back at PT. Typically, but not always. And so a real quick example is, let's say that we have a patient who is coming in, let's say they're in their upper 60s, and they're coming into a pain management clinic after having knee pain off and on for 5 or 6 years. And pain management says, oh, yeah, I can see here that you're having a lot of knee pain. Let's take an x-ray. Oh, wow, this x-ray shows that you have some arthritis. Not a lot, but you have some arthritis. And we're kind of getting into the part where we can have a conversation about how you probably need a knee replacement at some point, but not yet. So here's what we're going to do. How about this? Let's give you an injection straight into the knee, corticosteroid injection, and then let's send you to PT because there's probably a chance that something else other than arthritis is causing some of that knee pain. The patient goes, okay. So they get the injection that same day, and about a week later, they go to PT. And they show up in the PT clinic, and they sit down in Dr. H's office, and they say, hey, I'm here for knee pain, but I really don't have any anymore. And Dr. H goes, you just had a corticosteroid injection, didn't you? And the patient goes, gosh darn it, I did. How did you know that? Dr. H says, well, that's one of the few guaranteed ways that you're going to have less pain. And they said, well, I really don't know if I need PT anymore. And Dr. H says, okay, well, how about this? How about I assess you, because you're already here, you're already paying for it, and I'm going to take a look at all of your strength from your hips down to your ankles and your range of motion from your hips down to your ankles. And we're going to see if we find anything that we think might be contributing to that knee pain. And gosh darn it, don't you know it, Dr. H is a genius. And it turns out that this patient has really weak hips on the same side that he has knee pain. And he has really weak ankles on the same side that he has knee pain. And it just turns out that this whole leg is probably just weak, and that means a lot of extra force is going into that knee, and the patient's not walking with normal gait. Instead, they're just kind of swinging that leg around because it's so weak that they don't really want to bend it, and they're really landing kind of hard on it through the heel when they do step on it, and they're having a really hard time going from sitting to standing because they're shifting all of that weight onto the other leg away from the hurt knee. And you can kind of picture this whole I don't move well sort of human being, and I have a lot of pain on that leg, and everything just feels weak, and I don't use it because it hurts. And Dr. H says, well, here's what we have. We have a beautiful opportunity, a golden window, if you will, a golden window of opportunity to go in here while you have reduced pain, to strengthen the heck out of all these muscles, improve your range of motion. And what that's going to do is it's going to reduce the amount of force going into this knee. It's also going to help this knee perform better. It's going to move better. It's going to stabilize you better. It's going to help you walk better and get out of bed better. It's going to help you get up and out of the deep chair better, all these things. And the patient goes, you know what? Those are all things I didn't realize I wanted to get better. But now that you mention it, I do have a really hard time getting up and out of my chair, and I do have a really hard time walking around with my grandkids. I probably should do PT. There you go. Pain management opened the door with that injection. Now that the patient's in PT for the next 8 to 12 to 16 weeks, Dr. H is working with them, helping them get a lot stronger. As that injection wears off, the patient says, I still have a little bit of achiness, but nowhere near the same level of pain that I had before. And there you go. That is exactly how pain management and PT can work together to help that patient. Could also work the opposite way, where someone comes in, you try PT for 8 to 12 to however many weeks, patient's just not getting better and nothing really seems to make sense, and you refer them back to their primary care provider, and the primary care provider says, this looks like a case for pain management. The patient ends up in pain management. Pain management says, we're going to try some stuff like this, boom, 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 and then we're going to send you back to PT. Patient goes back to PT, reduced pain, do the strengthening, do the stretching, and they get better. It's just one of those beautiful relationships. It's a beautiful synergy that just seems to work no matter what order it comes in. If you can't tell, I'm a fan of pain management. Sorry, unashamed fanboy. So what to ask as a patient? So if you're a patient coming into your primary care provider and you're saying, who should I see, PT or pain management? Well, the fact that you're even asking that question is going to blow your doctor's mind, probably, because they're going to be like, how did you know? What podcast have you been listening to? And you can say, well, I listen to the World's Okayest Physical Therapy podcast. And your doctor will be like, that's quite a mouthful, but it sounds like it's pretty informative. The first thing they're going to ask as your primary care provider is if you're in acute pain, subacute pain, or chronic pain. And they're not going to ask it that way. They're going to say, hey, how long have you been in pain for? And when you tell them, that's going to tell them where they think that you should fall. A really good question to them is, hey, what's the long-term plan here? Like, I understand that you're sending me to PT, but if PT doesn't help me with my pain, what window should we call it at? Like, should it be 8 weeks, 12 weeks, 16 weeks? And we say, okay, we tried it for this amount of time. I'm still having pain. Can I get other options like pain management now? Other questions that you could ask is, hey, is it okay if I do PT before injections or before I get any sort of pain prescription? Because, I'm apprehensive about those things because whatever reason. Like I said earlier, a lot of patients are really forthcoming saying, I don't want to get addicted to something and I don't want to use something as a crutch, so I don't want those things. You can also say the opposite. Can I try PT after I get the injections? Because I know the injection is going to make my life way easier. You can also ask them the questions like, hey, what's the risks of this pain management treatment versus PT? And they might say, hey, you're getting this, acupuncture has almost no risks. You're perfectly fine. Or, hey, this does carry these risks, however rare that they are. And then another one that a lot of people tend to ask is that you can ask your doctor is, hey, I want to try PT. but can I also see pain management? And again, depending on where you're at in the time that you're having pain, they can be like, yeah, you know what, try PT and we'll set up a referral over to pain management as well. So there's definitely tons of questions that you could ask, but if you drive the conversation, if you typically ask hey, what's the long-term plan here? Because if PT doesn't work or if pain management is being involved, what's the next step or what's the thing that I can be doing at the same time? That tends to drive a conversation that gets you to the answers that you're looking for. Typically, just asking what's the roadmap tends to get you to where you want to be in terms of understanding between you and your doctor what the intent is and where your desired end state is, what your goals are. So, this has been the pain management versus physical therapy episode. Hopefully, now you can understand that it's not really a versus. This is one of those few cases where it's actually a synergistic relationship where both tend to work really well together. It's not really a question of is it one or the other. It's usually more a question of if it's both. And again, with the chronic pain discussion we had earlier, that kind of tells you how your primary care provider is going to take a look at that. If you're just not at that point yet where it's a chronic pain question, then you're in the acute and the subacute, and it's not time for both yet. Is usually, usually how that conversation goes. If you want to treat the cause of your pain and you're okay going for the long term, PT is usually the direction that you're going to want to go if you've been in that chronic pain situation. Or if you're looking for, hey, I just need pain relief because this is agonizing, and then once the pain is done, I'm willing for trying to do PT or anything else, then pain management is usually your first stop. But again, because of the synergistic between the two, usually PT and pain management are talking to each other. They're well aware of each other, and when you see a patient in your clinic as a physical therapist that you think could benefit from it, you've probably already brought it up. So, thanks for tuning in. Thanks for listening. Please don't forget to again like, comment, subscribe, leave a review as it's super helpful with the algorithm. And also check out the store. It's down in the description. I think it's hosted by Teespring. And also check out the Patreon, where there's some Patreon exclusive content. And yeah, thank you all for listening so much. Now everybody stay healthy, stay fit, and stay awesome. And I will catch you all in the next episode.